According to surveys, some 68% of pregnant women in the United States and other countries still give birth in back-lying positions.
Yeah.
So if you want to have a faster, easier and less painful delivery, then we recommend listening to what we have to say.
Right. So in this video, we are going to explain why back-lying labor positions are neither good for yourself nor for your baby. But we are also going to tell you why a back-lying position may nonetheless be the best labor position in your particular case.
Yes, this is Natalie, a pregnancy and birth consultant and TCM therapist.
And that's Matthias, a researcher and science geek. And on this channel, we help mummies and their babies naturally and science-based.
Alright, so let's get started. Okay, so why can back-lying labor positions be a problem for you and your baby? Well, the first reason is that if you are in a back-lying position, you do not make use of gravity at all, or you make less use of it depending on the kind of back-lying position, right? So what does this mean? Well, when you are in labor, there are several forces that help your baby descend in your pelvis. During the dilation phase, it's your contractions. In the pushing phase, on the other hand, your pushing efforts help you in addition to your contractions to push that baby out, right? However, there is also a third force that can help you in both stages of labor, and it must not be underestimated, and that is gravity.
Yes, gravity is that natural force which pulls your baby downwards when you are in an upright position. The problem is though that when you are in a back-lying position, gravity won't help you or help you less.
Yeah.
So all the force to help your baby descend in your pelvis must come from your contractions and your pushing efforts only.
Yes, the consequence of that is that, first of all, your dilation might take longer, right? And that's among others because if you do not make use of the full force of gravity, then your baby's head will put less pressure on your cervix.
Exactly. And not only that, another problem with back-lying positions is that you make it more difficult for your baby to move through your pelvis. Why is that? Well, because if you are lying on your back, it is much harder for your baby to find a better position in which baby can descend deeper into your pelvis.
Yes, that's a pity because it is very hard work for your baby to find a way through your pelvis, right? And that's because your pelvic inlet has a different shape than the center of your pelvis, and the center of your pelvis has a different shape than the exit of your pelvis, if you will. And so if you lie on your back, you don't actively support your baby move through your pelvis. Your baby will always be in the same angle, if you will, relative to your pelvis, right?
Exactly. And not only that, it is also a matter of the available room because back-lying positions keep the size of your pelvis small. In fact, there are labor positions which provide your baby with much more room in your pelvis, and this can become particularly important in the pushing phase when your baby is trying to take that last hurdle, which is moving around the pubis symphysis. Doing that can be very difficult for the baby. However, you can support your baby with the right birthing positions.
Yes. On top of that, scientists found that women who labor in back-lying positions have a higher likelihood of instrumental deliveries. So this means that there is a higher risk that your medical team has to support your baby's delivery with instruments such as forceps or ventouse.
Exactly.
Right?
The other thing is that episiotomies are also more likely in back-lying positions. Episiotomies are basically surgical cuts on your perineum in an effort to prevent tearing, right? And by the way, some but not all studies come to the conclusion that tearing is also more likely to happen in back-lying positions.
Right, so those were the adverse effects of back-lying positions on yourself. In addition, back-lying positions can also have adverse effects on the baby, right? First of all, studies found that the oxygen saturation in babies of women in back-lying positions is less than in women in upright birthing positions.
Yes, and it's probably that problem which leads to another one, namely that back-lying positions often lead to a fetal heart rate deceleration.
Yeah.
In other words, baby is more likely to be under distress, which causes their heart rate to drop.
Yes, and whenever that happens, medical interventions such as instrumental deliveries or C-sections become more likely, right? They want to get that baby out basically in order to make sure the baby receives enough oxygen.
Yes. Now, although there are lots of disadvantages of back-lying positions, we clearly want to point out that for some women, back-lying positions are still the best positions to give birth to a baby.
Yeah.
And we're not talking about women who have an epidural, because even if you do have an epidural, you can still change the position regularly to support your baby, at least to some degree, right?
Yes, but here's the thing. We know many cases of women who did try different kinds of labor and birth positions and still ended up in a back-lying position. And that's because to them, a back-lying position was the only position in which they felt capable of delivering their baby.
Right.
And so even if you now know that back-lying positions come with lots of disadvantages, please do not categorically say no to all of them.
Right. Instead, your job is to find a position which allows you to push that baby out. And if you end up in a back-lying position, so be it.
Yes, a friend of ours who happens to be an obstetrician told us that one woman gave birth on her belly. I mean, we don't know a single person on this planet who would recommend doing that. But that was the position she felt most comfortable with.
Right.
So if it worked for her, why not? Right?
Exactly. So try different kinds of labor and birth positions if you like, but find the positions which are most comfortable for you.
Yes, and keep in mind the question, what is your favorite position, will change over time as labor progresses, right? And as Natalie already mentioned before, there are also things that you can do to support your baby's descent when you have an epidural, because even in that case, it does not automatically mean that you can only be in back-lying positions throughout your labor, right? So if you want to know how to support your baby's descent and how to dilate faster when you have an epidural, watch the video that pops up now.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like below this video.
Yes, and for more useful tips and tools on pregnancy and baby-related topics in the near future, subscribe to our channel and hit the bell.